Impending or threatened condition. That means what? Impending, it has not occurred, it is going to occur in the future. So when a doctor says like an impending condition, see if this condition has occurred. If that condition has occurred, say we commonly say like impending abortion. If abortion has occurred, report as abortion itself because a condition has occurred. If it has not occurred, then what you should do is like report the conditions that exist now. Say for example, if it is going to be an impending heart failure, has a heart failure has occurred? No. But now what has happened? There is some other problem like palpitation, dizziness and all. You can very well report the existing condition. Under this impending, we have very few conditions that are listed. So you'll have to go and see, take for instance, myocardial infarction. If it is an impending myocardial infarction, we have a specific code. You can very well report it because you have the code. Impending MI, you have a code. But if you don't have a code for under this impending, if it is not classified, you should not report it because there is no code. You will have to report what the current problem the patient is having. If impending abortion, you can very well report menorrhagia because menorrhagia is a symptom that the patient is having. You can very well report the existing complaint which is menorrhagia. Can you understand? So that's the rule under impending or threatened. If it's occurred, you can report. Otherwise, see the listing, you can very well report that code. If even that is not listed, report the condition or the symptom that the patient currently has.